A very good morning. Over the next 15 minutes, I'm going to talk about the unmasking the hidden threat. That is a femoral nerve palsy from the iliopsoas haematoma following post-viper snake bites. Before going in detail, this is a small introduction about our center. It is a multi-specialty hospital catering for the 5 districts in the western side of southern Tamil Nadu, especially catering for the rural and the tribal areas. Though it is a multi-speciality, we have a center of excellence for both the toxicology as well as toxinology. I'm basically a qualified toxicologist from Sri Lanka. And every year, approximately 450 to 475 snakebite victims were treated in our center for past 10 years. And out of which 200 patients needs ICU care. ICU care is not just admitting the patient and putting a anti-snake venom, really with a lot of other multi-organ involvements. And we have a special toxinology ICU, especially for the snake bite and scorpion bite. We get quite a large number in our area. And we have a facility to do a plasmapheresis. We have a MARS. We have a point of care ultrasound and point of care test. So our center is fully equipped to handle any kind of emergencies to handle with the toxinology victims. So with this background, I move on to the today's objective. This is to report and analyze a spontaneous. This is a very rare and first time we are seeing this kind of patients. This is to analyze spontaneous iliopsoas haematoma with the femoral nerve palsy. This is due to compression following a viper bite, and as well as to analyze the clinical laboratory details of spontaneous occurrence of iliopsoas haematoma in those treated with viper bite, and try to explain what could be the possible mechanism lying behind this. So this is out of 4,750 cases over a period of 5 years, and we reviewed and we found that 8 patients were been fitting into this criteria who developed iliopsoas haematoma, and we reviewed their clinical history, laboratory data, imaging, and as well as the treatment with an hospital course and outcome. Moving on to the patients, identifying the victims, the patients included in the studies were 8 patients, out of which 6 are male and 2 are females. The mean age of patients was starting from 16.6 with a plus or minus of standard deviation of 3.4 years. So both Russell viper as well as saw-scaled viper were involved in this case. The patients who have been bitten with the Russell viper, 5 patients were belonging to Russell's viper and 3 were belonging to saw-scaled viper. Out of this 8 patients, 6 patients were bitten in the lower limb and 2 in the upper limb. Identifying this occupation, majority of these people are farmers, and they are been bitten while they were working, and considerable amount of housewives also involved when they are been working in the backyard. So every house in the rural India have a backyard where a lot of plantations and vegetation will be there, and even they will hatch the hen, and this makes the snakes, this attracts the snakes to come into the dwelling. And few of them are students who are walking in the rural roads where they have been bitten, and others were person who have been climbing the tree. I'm coming in detail in subsequent slides. If you see the place of bite, majority of them are in the field, and house shares the more than 60% of our case load. And the students who have been walking, they have been there bitten by the in the road, and a few in the farm, and few while they were climbing the tree, like a coconut tree or a mango tree, trying to plucking the fruits. So I already mentioned about the anatomical side. The majority of them are in the lower extremities and others are in upper extremities. Moving on to this, the patients, when they have been bitten and bringing to the emergency room, when the patient satisfies the criteria, both clinically as well as laboratorily to show the envenomation, these patients will be treated with anti-snake venom. Especially to our patient cases, the index patient initially had been treated and then subsequently developed a pain. All these patients have been, after giving ASV, the blood parameters like hematology, renal function test, liver function test, and other normal blood events have been within normal limits. And as a protocol, we do inflammatory markers in snake bite, where we have seen these kind of patients who have been elevated inflammatory markers like D-dimer, 13, and CRP are there more prone to develop various other complications. Not only this iliopsoas hematoma developing femoral nerve palsy, we have seen patients developing a peripheral thrombosis, a patient developing a bite site hematoma, or pseudoaneurysm, going for a splenic rupture. Various other cases have been also seen, and particularly we found out uniform among these patients who have been having an elevated inflammatory markers. And out of this 8 patients, 2 patients had a low platelet count varying from 120,000 to 124,000 cubic millimeter. Actually, this symptoms begins after 10 to 15 days of bite, not immediately after the bite. These patients take their own time and they develop 10 to 15 days after the bite with a mean onset of femoral neuropathy. It is within 3.5 days after the hemorrhage. Actually, what really happens is these patients will be experiencing lower abdominal pain, or when you are doing a palpation, you can be able to palpate a mass-like structure, and they're also complaining of severe low back pain, constipation, and when they are lying, they will be trying to keep their limb flexed and externally rotated hip so that the pain with the hip movement is reduced, and variable lower extremity pain will be there. Most of the time, these patients were being diagnosed as sciatica or lumbosacral pain or lumbosacral torsion, because all these are manual workers. So this patient will be subsequently sent for an MRI, where MRI incidentally trying to find out some hematoma. And once the hematoma is developed, slowly they will be trying to complaining of pain, which has not been relieved with the conventional analgesics, even with the paracetamol or a tramadol. So they require further stepping ladder of analgesia has been needed. And they will, the very important sign is they will be having a paresthesia to complete numbness in the distribution of femoral nerve. That is very important. Another one important clinical sign we observed was all these 8 patients had loss of patella reflex. And if the patient is trying to walk, they will be trying to have a bucking of the knee and they were not able to walk properly. They will try to fall. So most of the time, again, this patient ultimately land to a neurologist and go for an extensive investigations like CT or an MRI brain or a MRI complete spine, and then later it will be diagnosed as iliopsoas hematoma. So this is a CT. You can see this is an axial view of an CT showing a large iliopsoas hematoma. Iliopsoas hematoma. You can see this collection. I'm just to identify I just given a color shade to differentiate this from another normal visceral structures of the abdomen. You can see a gross haematoma and trying to compress the femoral nerve. And this is a CT coronal view. You can see this is a large iliopsoas haematoma, and you can see a little active bleeding is still going on. And this is compressing the femoral nerve. This is on the CT coronal view, and I have just given a color to differentiate to from the other viscera. And this is a structure, a schematic picture. It's an iBird view to know how much patients having a large hematoma. So this is a first patient who had a right side weakness, had a right iliopsoas hematoma, and this fourth patient had a left, and seventh patient had a left. You can see this second patient had a left, and in our series, majority of them are in the left side compared to right side. So right, only 2 patients, and other remaining 6 were into the left side. So all these patients, after treating with ASV and giving with an analgesic and other supportive treatment, still the patient's pain is worsening, symptoms is not improving. This patient underwent a surgical decompression to relieve the compression of the femoral nerve. Out of 8 patients, 5 patients underwent a surgical evacuation of iliopsoas hematoma was completely removed. And remaining 3 patients were managed conservatively. And the recovery time was ranging from 4 to 7 weeks in the conservative groups and 3 to 6 weeks in the surgical groups, because the hematoma has to resolve completely. So we have to wait for the period of time. What are the outcomes and what are the challenges we felt here is out of 8 patients, 7 patients had totally complete recovery, with 4 in the surgical group and 3 in the conservative group. One patient in the surgical group had a partial recovery because the compression was very high, and it was and now has gone for ischemic because of this compression, and it took long time for a recovery, but still the residual weakness is there in this patient. The important challenge we had was a diagnostic challenge, because this was a very vague presentation, and we didn't expect, because there is no previous literature to support this kind of hematoma in the snake bite. And all these 7 patients who have been recovered totally all went to their work back, and this one patient was still dependent and having a disability. This, and the important thing is we don't know which patient needs CT and which patient needs ultrasound. So the point of ultrasound, when we do doing a focus abdominal sonography for a trauma like that, we can have a focused abdominal sonography for snake bite. We can have that so that we can know where the bleeding is there any compression is there, so that the nerve can be easily, we'll try to relieve the compression of the nerve at the earliest, so that this residual weakness can be prevented. And other important thing is snake bite is not an one-time disease. So if this patient needs a long-term follow-up and have a has been to be screened for the early management. We are seeing a lot of long-term complications, not just a wound complication or a contracture. We are seeing hormonal disturbances. We are seeing a lot of electrolytic imbalance post-discharge. This kind of patients are there, which needs long-term follow-up. So moving on to the course in the hospital, these patients developed one or other symptoms of iliopsoas hematoma 10 to 15 days after the initial snake bite. As I already told, the time interval was varied with the conservative and as well as surgical, and all these patients were followed up for the 6 months follow-up. Another important thing is the surgeons were very hesitate and reluctant to open this case because again, this was new to them, and they don't know whether this hematoma will been unsolved, and whether if they remove it, further bleeding will be there. So that kind of important things was not being known to the surgeon, and it should be a better that this case should trigger for an algorithm when to keep the patient as an conservative, when patient can be taken for the surgical decompression to relieve the nerve compression, or whether it is based on the size of the hematoma or site of the hematoma, and how often this can occur, and when we can intervene. These are the various challenges occurs because we are in the rural area where we need to treat the patient both conservatively as well as the surgical things. So not only Russell Viper, both Saskeld as well as Russell Viper can cause these kind of thing. And most importantly, all these patients were adequately treated with anti-snake venom, and their coagulopathy totally normalized, and then patient is discharged. Subsequently, the patient developed these kind of problem. So it is always advisable, and to avoid the medical legal complications, it is better to note in the discharge summary that these patients can develop these kind of subtle symptoms that has to be reported early to prevent the delayed complications, and the delayed diagnosis and intervention can be prevented so that these patients can be treated at the earliest. So as I already told, the 7 patient improved, but 1 patient, actually he is a breadwinner of the family, still he is having a disability, not able to go to the work, and there is suffering from a prolonged pain and a quadriceps weakness, is not able to stand and walk without any support. Even for his normal routine, like going for the restroom or taking for the bath, he needs some support. So the morbidity and the productivity of the patient is being reducing the productivity, so that they are getting more worried about this snake bite. So from this case series, the lesson we learned was we have to recognize the early subtle symptoms as to be uh, identified early. So the healthcare provider has to be sensitized, and he should be vigilant in recognizing the subtle symptoms of iliopsoas hematoma, so that the femoral nerve palsy following the snake bite can be identified early, so that early whether we can go for a conservative management or a surgical management to minimize the nerve damage, because once the nerve has been damaged, it takes years to time to regenerate and recover, and we need to have a comprehensive care. It is not just a snake bite, giving ASV, neutralizing, sending them home. We have to have a multidisciplinary approach to follow a long-term complication in the effective management for the snake bite, so that it will be help us to prevent. So to conclude, the spontaneous occurrence of iliopsoas hematoma, even after completing the treatment of viper envenomation, is not uncommon, even in an uncomplicated cases. Don't uh, expect that only in a complicated case like a patient having a profound coagulopathy or over bleeding can have this kind of complication. Even in a subtle patient, this kind of patient can develop iliopsoas
Could you bring your
hematoma.
talk to an end, Dr. Senthil, please? Thank you.
I'm just concluding, sir.
Please
This is
conclude, yes.
independent of gender, bite site, and of the viper bite, and we need to create an awareness on such a event. So among the practitioners involved in treating the snake bite management, and very importantly, if there is any elevated inflammatory markers, we have to have a more cautious in treating this patient. Thank you, sir. Thanks for the opportunity.